Dr. Wilson entered the cafeteria with MR images in his hand. His mood was low. "We might lose this patient," he muttered to himself. Margaret was serving food when she accidentally glanced at the images. She stopped, looked again, then spoke in an unusually clinical voice. "Doctor, there's a glioblastoma in the left temporal lobe." At that moment, no one could fully comprehend what she had just said. From which city in the world are you watching this video today? If stories of hidden medical expertise and unexpected diagnoses resonate with you, subscribe for more tales of extraordinary people whose true capabilities emerge in moments of crisis. The morning light filtered through the large windows of St. Mary's Hospital cafeteria as Margaret Chen began her daily routine. At 58, she had worked in the same position for 8 years, arriving each day at 5:30 a.m. to prepare breakfast service for the hospital's staff, patients, and visitors. Her movements were precise and economical, arranging food displays, checking temperatures, ensuring every detail met health department standards. To the hundreds of people who passed through the cafeteria daily, Margaret was simply part of the background. The quiet Asian woman who served meals with efficient politeness, remembered regular customers' preferences, and kept the dining area spotlessly clean. She rarely spoke beyond the necessities of her job, and fewer still bothered to learn her name. Dr. James Wilson, a third-year neurology resident, was one of the few staff members who acknowledged Margaret with more than a perfunctory nod. During his frequent visits to grab coffee between rounds, he had noticed her attentiveness to conversations, the way she seemed to absorb information while appearing to focus solely on her work. On Tuesday morning, October 8th, Dr. Wilson entered the cafeteria, carrying a manila folder containing MRI scans that had been troubling him for the past 2 days. The images belonged to Maria Santos, a 34-year-old teacher who had presented with persistent headaches and episodes of confusion. The initial scans had been read by the radiology department, but something about their interpretation didn't align with Dr. Wilson's clinical observations. "Morning coffee?" Margaret asked as Dr. Wilson approached the service counter, noting his distracted expression. "Please," he replied, barely looking up from the folder. "Make it strong today. Long night ahead." As Margaret prepared his coffee, Dr. Wilson spread the MRI images across a nearby table, studying them with the intense concentration of someone wrestling with a complex diagnosis. The radiologist had noted possible inflammatory changes in the report, but Dr. Wilson's instincts suggested something more serious. "We might lose this patient," he muttered to himself, running his hand through his hair in frustration. Margaret approached with his coffee, intending to simply set it down and return to her duties. But as she placed the cup on the table, her eyes inadvertently fell on the MRI images. What she saw made her freeze mid-motion. The brain scans showed classic signs that were unmistakable to anyone with proper training: a heterogeneous mass with irregular margins, surrounding edema, and characteristic enhancement patterns. The radiologist had either missed the diagnosis entirely or lacked the experience to recognize the subtle but definitive indicators. Margaret looked at the images again, her trained eye automatically cataloging the pathological features she recognized from thousands of similar cases. Then, in a voice that carried clinical authority she hadn't used in 8 years, she spoke. "Doctor, there's a glioblastoma in the left temporal lobe." Dr. Wilson looked up sharply, confusion replacing his previous preoccupation. "I'm sorry, what did you say?" Margaret realized what she had done. Broken 8 years of careful silence with a precise medical diagnosis that no cafeteria worker should have been capable of making. But looking at the images again, seeing the clear signs of a malignant brain tumor that was being missed, she couldn't remain silent. "The mass in the left temporal region," she said quietly, pointing to a specific area on the scan. "The heterogeneous enhancement pattern and the surrounding vasogenic edema are consistent with glioblastoma multiforme. The radiologist report is incorrect." Dr. Wilson stared at her, his mind struggling to process what he was hearing. The woman who had served him coffee every morning for 3 years had just provided a detailed radiological interpretation using terminology that even some medical students struggled with. Margaret, he said slowly, how do you know those terms? Before she could answer, Dr. Sarah Chen, the chief neurology resident, entered the cafeteria and approached their table. She had overheard the last part of the conversation and was equally bewildered. Dr. Wilson, who were you just discussing the case with? This is Margaret, Dr. Wilson replied, gesturing toward the cafeteria worker, who now stood rigidly beside the table. She just diagnosed a glioblastoma. From looking at the MR, Dr. Chen's eyebrows rose. I'm sorry, what? Margaret wished she could disappear, but the damage was done. 8 years of anonymity had been shattered, in a moment of professional instinct that she couldn't suppress. Margaret, Dr. Chen said gently, could you explain what you see in these images? Margaret looked at the two residents, then back at the scans. The part of her that had been Margaret Chen, one of the most respected neurosurgeons on the West Coast, couldn't ignore the clear pathology in front of her. The lesion shows ring enhancement with central necrosis, she began, her voice growing more confident as her suppressed expertise reasserted itself. The surrounding white matter changes indicate significant mass effect. The location in the left temporal lobe explains the patient's language difficulties and confusion episodes. This is a grade IV astrocytoma, glioblastoma multiforme. Both residents stared at her in stunned silence. The precision of her analysis was beyond what many attending physicians could provide. Margaret, Dr. Wilson said carefully, where did you learn to read MRIs? Margaret was quiet for a long moment, weighing 8 years of carefully maintained anonymity against the reality that her cover had been irreparably blown. I used to be a doctor, she said finally. What kind of doctor? Dr. Chen pressed. Neurosurgeon. The word hung in the air like a physical presence. Dr. Chen and Dr. Wilson exchanged glances, trying to reconcile the quiet cafeteria worker they thought they knew with the medical professional who had just demonstrated expertise that surpassed their own. Margaret, Dr. Chen said slowly, what's your full name? Dr. Margaret Chen, she replied, using her professional title for the first time in 8 years. Dr. Chen's face went pale. Margaret Chen, as in Dr. Margaret Chen, who pioneered the minimally invasive approach to temporal lobe resections, the Dr. Chen who published the landmark studies on glioblastoma treatment protocols. Margaret nodded reluctantly. Dr. Wilson dropped into a chair. You're the Dr. Chen, the one they call the miracle worker in neurosurgical circles. You've been serving me coffee for 3 years. I've been working here for 8 years, Margaret corrected gently. But why? Dr. Chen demanded. You were at the top of your field. Your techniques are still being taught in medical schools. Why are you working in a hospital cafeteria? Margaret looked out the cafeteria windows at the city beyond, considering how much truth she was willing to reveal. Because I lost a patient, she said finally. A 7-year-old girl with an inoperable tumor. I tried an experimental approach and she died on my table. Her parents sued, the hospital reviewed my privileges, and the media called it medical malpractice. The Jessica Martinez case, Dr. Chen said quietly, recognition dawning. I remember reading about it in medical school. That case was cited as an example of surgical hubris, Dr. Wilson added, then immediately looked embarrassed for bringing up what was clearly a painful memory. Margaret nodded. The tumor was inoperable by conventional standards, but I thought I could save her. I was wrong. After that, I couldn't go back to surgery. Every time I held a scalpel, I saw her face. So you disappeared, Dr. Chen observed. I found a job where I could still help people, but in a way that didn't require making life and death decisions. Serving food to healthcare workers seemed appropriate. Dr. Wilson studied the MRI images again. But your diagnosis of this case, it's spot on. The radiologist completely missed it. Experience doesn't disappear, Margaret replied, even when you wish it would. Dr. Chen pulled out her phone. I need to call the attending. If you're right about this diagnosis, we need to get this patient into surgery immediately. What if I'm wrong? Margaret asked quietly. Are you wrong? Margaret looked at the scans once more, her trained eye confirming what she had seen initially. No, that's definitely a glioblastoma, high grade, aggressive. The patient has weeks, maybe months without surgical intervention. Dr. Chen made the call, explaining the situation to Dr. Robert Harrison, the chief of neurosurgery. Within 20 minutes, Dr. Harrison himself appeared in the cafeteria, striding directly to their table. "Dr. Chen," he said, addressing Margaret with the respect her former reputation commanded, "Sarah tells me you've identified a misdiagnosed glioblastoma. The radiological findings are consistent with GBM." Margaret replied, falling back into the clinical language that had once been as natural as breathing. Dr. Harrison examined the MRI scans carefully. "You're absolutely right. This is a clear case of glioblastoma multiforme. The radiologist who read this needs additional training." He looked up at Margaret. "Your reputation wasn't exaggerated. Even after 8 years away from practice, your diagnostic skills are exceptional." "Thank you," Margaret said quietly. "Dr. Chen, I have a proposition for you." Margaret tensed. "I'm not looking to return to active practice. I'm not asking you to. But we could use someone with your expertise as a consultant, reviewing difficult cases, providing second opinions, training residents. You could help save lives without holding a scalpel." Margaret was quiet for several minutes, considering the offer. "I'm not licensed to practice anymore. We can work with the medical board on consulting privileges. Your knowledge is too valuable to waste in a cafeteria." "I like working in the cafeteria," Margaret said defensively. "I'm not asking you to leave it," Dr. Harrison clarified. "I'm asking you to expand your role here. Keep serving coffee to stressed residents, but also help us make sure we don't miss diagnoses like this one." Over the following days, word of Margaret's true identity spread throughout the hospital. Staff members who had barely noticed her for 8 years suddenly looked at her with new respect and curiosity. Some were embarrassed by how they had overlooked someone of her caliber. Others were simply amazed by the discovery. The patient with the glioblastoma, Maria Santos, underwent successful surgery 3 days later. The tumor was removed with clear margins, and she was referred for adjuvant therapy. Dr. Harrison made a point of introducing Margaret to Maria and her family. "This is Dr. Margaret Chen," he told them. "She's the doctor who identified your tumor when others missed it. She may have saved your life." Maria's husband shook Margaret's hand with tears in his eyes. "How can we thank you? Just focus on getting better," Margaret replied. "That's all the thanks I need." A week after the diagnosis, Margaret found herself in an unusual position. She was still working in the cafeteria, but now residents and attending physicians regularly brought her difficult cases to review. Her corner table had become an informal consultation area where she examined scans and provided insights that often proved crucial to patient care. Dr. Wilson, who had unwittingly triggered her exposure, became one of her most frequent visitors. During one of their morning consultations, he asked the question that had been troubling him since that first day. "Dr. Chen, do you ever regret leaving surgery?" Margaret considered the question while reviewing a scan of a suspected arteriovenous malformation. "I regret the circumstances that led to my leaving," she said finally. "But I don't regret finding a different way to help people. Even though you could be saving lives directly, I am saving lives, just differently. The patient whose glioblastoma I diagnosed, she's alive because I happened to see her scan. That's not less meaningful because I wasn't holding the scalpel." Dr. Wilson nodded. "But don't you miss the surgery itself? The technical challenge, the precision required?" Margaret set down the scan and looked at him directly. "Every day. But I also remember why I stopped. Surgery requires absolute confidence in your decisions. After Jessica Martinez, I lost that confidence. Even if my hands were steady, my judgment was compromised by doubt. And now I can use my knowledge without the responsibility of making irreversible decisions. I can identify problems and guide others toward solutions. It's a role that fits who I've become." 3 months after her identity was revealed, Margaret's unofficial consulting role became official. The hospital created a new position, Senior Diagnostic Consultant. She would continue working in the cafeteria, at her own insistence, but would also be available for complex case reviews and resident education. Her first formal lecture was titled "Diagnostic Pitfalls in Neuroimaging." The hospital's main auditorium was packed with residents, attending physicians, and medical students eager to learn from the legendary neurosurgeon who had emerged from 8 years of anonymity. "The most dangerous assumption in medicine," Margaret began, "is that your first impression is correct. Every image, every scan, every symptom deserves a second look. Sometimes the most important diagnosis comes from the most unexpected source." In the audience, Dr. Wilson smiled. He knew exactly what she meant. After the lecture, Margaret returned to the cafeteria for the evening shift. As she served dinner to the staff, many of whom had just attended her presentation, the dynamic had changed completely. She was no longer invisible background. She was a valued colleague, whose insights were actively sought. Dr. Harrison approached her station during the dinner service. "Dr. Chen, I wanted to thank you for the lecture. The feedback has been exceptional." "I'm glad it was helpful," Margaret replied, filling his coffee cup. "I also wanted to discuss expanding your role. The medical school has expressed interest in having you teach diagnostic imaging to fourth-year students." Margaret paused in her work. "That would mean leaving the cafeteria more often." "Only a few hours a week. You could still maintain your primary role here." "Why is this job so important to you?" Dr. Harrison asked gently. "I understand finding peace after trauma, but surely you could find other ways to serve that would utilize your full capabilities." Margaret was quiet for a moment, watching the evening crowd of healthcare workers grab quick meals between shifts. "In surgery, I helped one patient at a time," she said finally. "Here I feed hundreds of people every day who dedicate their lives to helping others. I provide sustenance for the people who save lives. It's a different kind of medicine, but it's still medicine." Dr. Harrison smiled. "I never thought of it that way. Plus," Margaret added with rare humor, "I get to catch the occasional misdiagnosed brain tumor." 6 months later, Margaret had settled into her expanded role. She remained the primary cafeteria worker for the morning shift, but now also served as a diagnostic consultant and part-time instructor. Her story had become legend within the hospital. The brilliant neurosurgeon who had chosen to serve food rather than seek glory, and whose hidden expertise had saved lives from the most unexpected position. Dr. Wilson, now in his final year of residency, had become something of a protégé. Margaret mentored his diagnostic skills while he helped her stay current with new developments in neurosurgery and imaging technology. "Dr. Chen," he said during one of their morning consultations, "I've been accepted into a neurosurgery residency program at Johns Hopkins." "Congratulations," Margaret replied, genuinely pleased. "You'll be an excellent surgeon. I wanted to thank you. Your guidance over the past months has been invaluable. You've taught me to see things I would have missed. You had the instincts already. I just helped you trust them. Will you consider returning to surgery someday?" Margaret looked out at the cafeteria, bustling with the morning rush of hospital staff grabbing breakfast before their shifts. "This is where I belong now. I've found a way to practice medicine that aligns with who I've become, not who I used to be. And if another glioblastoma walks through that door," Margaret smiled, "then I'll make sure it gets diagnosed correctly." Some skills are too important to keep hidden. As Dr. Wilson left for his rounds, Margaret returned to her morning routine, serving breakfast to the dedicated healthcare workers who trusted her with their nourishment, just as they now trusted her with their most difficult diagnostic challenges. The quiet cafeteria worker had become something unprecedented, a medical consultant who measured her success not in surgical victories, but in the lives she touched through her daily service. She had discovered that healing could take many forms, and that sometimes the most profound medical practice happened not in operating rooms, but in the simple act of caring for those who cared for others. In her pocket, she carried the thank you note that Maria Santos had written 6 months after her successful surgery. "To Dr. Chen, who saw what others missed and gave me back my life. Thank you for being exactly where you needed to be when I needed you most." Margaret understood now that she hadn't been hiding in the cafeteria for 8 years.
she had been preparing for moments like these, when her expertise could emerge naturally from a foundation of humble service. The greatest medical practice wasn't about recognition or reputation, it was about being present when healing was needed regardless of the form that healing took. Sometimes the most important diagnoses come from the most unexpected places, made by people whose true capabilities are hidden behind the ordinary tasks they choose to perform with extraordinary care.